This week, Prime Minister Scott Morrison said Australia is on the road back to normality, but is warning against complacency in the COVID-19 crisis. The Prime Minister has flagged industrial testing and ramped up tracing as key to easing restrictions. So just how close are we to taming the virus in Australia? Well, I had the honour to speak to Professor Bill Rawlinson this week, Senior Medical Virologist at the University of New South Wales. Professor, thank you very much for joining us this morning. Prime Minister Scott Morrison said Australia is in a good position after completing the first of a 4-week holding pattern. What are some of the main reasons for keeping our confirmed COVID-19 cases down?
I think that there are multiple reasons. I don't think there's just one. And certainly the quarantining and the early response. Remember, Australia declared a pandemic a couple of weeks ahead of the rest of the world. I think that local public health people have been working very hard. They've been chasing up cases. They've been, talking to people. I think, thirdly, that there's been a lot of support in the public for this. It's been well explained. It's been well understood, and people have been quarantining. We've been diagnosing a lot. Testing is very important, so you tell people whether they're infected or not. And overall, those things have really contributed to what we're seeing now.
How contagious is COVID-19 and how long does it last on surfaces?
It is a contagious virus in the sense that it's somewhere between what we saw with SARS almost 20 years ago, which was less contagious but in many ways killed a greater percentage of people, versus the other coronaviruses, which is more like the common cold, which tends to spread more easily. So it's somewhere in between those. Certainly what we do see is that if you are in close contact, that is face-to-face, those droplets can spread from one person to the other, whereas we think that casual contact is less likely to spread it, although still possible. Surface spread is probably less likely. When you get infected with a virus, you not only have to have the virus in the right place, that is in your nose or your mouth or your eyes, but you also have to have a certain amount of virus to overcome your natural immunity. And so surfaces generally don't have enough virus. The virus lives on fabric, for example, for only a period of hours, maybe 8 or 10 hours, maybe shorter. The virus can be detectable on surfaces like stainless steel and plastic for up to 7 or 8 days. But again, just being detectable doesn't necessarily mean that that's going to infect you. It's got to be alive. It's got to be enough.
And what is the likelihood of there not being immunity to COVID-19?
Look, it's a very good question and clearly one that's occupying our thoughts at the moment. It does appear from things like SARS, and that's our best example at the moment, that the infection does raise some immunity in most people, and that immunity prevents subsequent infection over a period of months. Whether that immunity lasts lifelong, again, comparing with SARS, it appears not to. It probably decreases over a period of a year or two. It does seem that it is not a virus that creates lifelong immunity, but we really, of course, have only 3 or 4 months' experience. And so what we're relying on is our previous experience. And I think what we're going to be doing in the future is measuring immunity, not only using antibody tests, but using some more sophisticated tests that we do in research, where we look at what we call cell-mediated and acquired immunity in different ways. So we hope to have the answers to that, but that's going to take, I think, several months and some more research.
Still very early days. Schools, Professor, are in the process of changing lockdown restrictions. What issues do you think we're going to be facing?
The issues with school lockdowns are, of course, complex and outside what a virologist does in some ways, because they involve politics and policy. They involve a lot of public health. They involve also what the virus is doing. From a virological point of view, putting large groups of people together, of course, is a risk. But what you do is have control of the virus before you do that. And as I understand it, that's exactly what public health authorities are doing. Once you get enough decrease in your cases, and once you're seeing a reduction in new cases, and once you're seeing appropriate diagnostic screening of the population, then you can be confident that the risk becomes much lower, and that's when you can look at groups of people like school children coming together. Of course, one of the issues that has been discussed over time has been asymptomatic infection, and you certainly do see that, and you do see that in children, and so that's something that's going to be considered, and public health are certainly discussing that in considering schools going back.
Thank you so much for your expertise and time this morning. Do take care and stay well.
You take care too. Thanks for your time.